One in every two women over the age of 40, and more men than anyone wants to admit, is currently living with what they were told is arm fat, loose, soft, jiggling skin on the back of the upper arm. They were told to do more tricep dips, more push-ups, less bread, more cardio, and yet the arms never change. Here is what nobody is telling you, and here is what I have watched destroy the self-confidence of hundreds of my patients. The tissue hanging from your upper arm in most cases is not fat at all. It is not a calorie problem. It is not a laziness problem. It is not a genetic curse you inherited from your grandmother. What you are looking at, and I want you to really hear this, is a structural and biochemical failure happening at the cellular level inside your connective tissue. It is a silent physiological event that begins in your 30s, accelerates in your 40s, and by your 50s has already remodeled the entire architecture of your skin and the fascia underneath it. This is not a fat problem. This is a collagen matrix collapse problem. And the reason the distinction matters so much, because if you keep treating it like a fat problem, you will keep failing. You will keep doing tricep kickbacks that do absolutely nothing to the connective tissue web underneath that skin. You will keep cutting calories and watching the scale go down while your arms stay exactly the same. I have been practicing integrative and functional medicine for 15 years. I have reviewed the histological studies, I have read the biopsy data, and today, I am going to walk you through exactly what is happening at the molecular level, inside the tissue of your upper arm, why the standard system completely ignores it, and what you can start doing today with things already in your kitchen to begin reversing it. Stay with me, because by the end of this video, you will never look at your arms the same way again. Let me be direct with you about something that took me years of practice to fully understand. The healthcare system, the one built on insurance codes, pharmaceutical partnerships, and 15-minute appointments, does not profit from teaching you this. There is no billing code for collagen restoration counseling. There is no reimbursable procedure for fascial hydration protocol. Your primary care physician, even if they are a brilliant, caring human being, was trained in a system that rewards the diagnosis and treatment of disease, not the prevention of tissue degradation that hasn't yet generated a diagnosis. Nobody in a white coat is going to tell you this. And why would the cosmetic industry correct you? The arm-firming creams, a multi-billion-dollar global market, are entirely dependent on you not understanding the real mechanism. Because if you understood the real mechanism, you would stop buying the creams. You would stop booking the procedures. You would stop buying the toning supplements that don't address a single root cause. I want to be clear. I am not anti-medicine. I am anti-ignorance. The system is not evil. It is simply designed around a revenue model, not a wellness model. And once you understand that distinction, you stop waiting for permission from the system to take control of your own biology. What I am about to share with you is not alternative medicine. It is not fringe. It is documented, peer-reviewed, published physiology. The research exists. It is just not in the format of a pharmaceutical pitch, so it does not make it into most clinical conversations. You deserve better than that. Let's begin. Before I go any deeper, and trust me, we are going to go very deep into the biology here, I want to ask you a quick favor. This channel is trying to reach 100,000 subscribers. We are close. Every single subscriber genuinely helps this content reach someone who needs it. Someone who has been told for the 10th time to just exercise more and is about to give up. If this kind of honest, evidence-based information is what you come here for, hit the subscribe button right now and tap the like. It costs you nothing, and it means everything for the reach of this channel. And share this with someone you love who is struggling with this exact issue. You might change how they see their body completely. Now, let's talk about what is actually happening inside your arms. I want to take you on a microscopic journey into the tissue of the upper arm, because once you see what I'm about to describe, it cannot be unseen. And it will immediately explain why the conventional approach produces no results. The architecture of healthy upper arm. Tissue. Your upper arm skin is supported by an extraordinary three-dimensional scaffold. Picture a net made of rope, strong, dense, interwoven. That net is primarily composed of type 1 and type 3 collagen fibers, manufactured by specialized cells called fibroblasts that live within your dermis. Woven through that collagen matrix are elastin fibers, the component responsible for your skin snapping back after being stretched, like a rubber band. Between the dermis and the underlying triceps muscle lies a layer called the superficial fascia, a sheet of connective tissue that acts as both anchor and cushion. When the superficial fascia is dense, well hydrated, and rich in collagen, it holds the skin tightly to the underlying structure. The arm looks firm. The skin sits close to the muscle. There is no draping, no jiggling, no bat wing. Now here is where the story turns, the cascade of collapse. Starting around age 30 and dramatically accelerating after 40, your body begins producing less collagen, not a little less. According to research published in the British Journal of Dermatology, collagen production declines at approximately 1% per year after the age of 25. By the time someone is 50, they may have lost more than 25% of their dermal collagen density. But here is what most people don't know. The problem is not only about how much collagen your body makes, it is about what happens to the collagen that already exists. As we age, and this is accelerated dramatically by chronic low-grade inflammation, high blood sugar, UV exposure, smoking, and alcohol, a process called glycation begins degrading the collagen fibers. Glycation occurs when sugar molecules bind non-enzymatically to the collagen protein, forming what are called advanced glycation, end products, or ages. These ages cause the collagen fibers to become rigid, brittle, and cross-linked in abnormal patterns. The net that was once strong and elastic becomes stiff, sparse, and fragmented. Simultaneously, an enzyme called matrix metalloproteinase, or MMP, becomes overactivated. MMPs are collagen-degrading enzymes that, under normal circumstances, exist in a careful balance with their inhibitors. But under conditions of inflammation, oxidative stress, and hormonal decline, this balance is disrupted. MMPs begin destroying collagen faster than fibroblasts can synthesize new fibers. You are losing the scaffold faster than you can rebuild it. The result? The dermis thins. The superficial fascia loses density. The skin loses its mechanical anchor to the underlying muscle. It begins to drape. It begins to sag. It fills with interstitial fluid, because the lymphatic channels that run through the fascia become sluggish when the tissue structure degrades. This fluid accumulation makes the tissue feel soft and puffy, not firm, and it is frequently mistaken for fat. The role of the mitochondria. Here's the part that almost no one is talking about in this context. Your fibroblasts, the cells that manufacture collagen, are entirely dependent on mitochondrial energy production to function. Collagen synthesis is one of the most energetically expensive biochemical processes in the human body. It requires adequate ATP, the energy currency produced in the mitochondria. It requires sufficient vitamin C to act as a cofactor for the enzymes prolyl hydroxylase and lysyl hydroxylase, which stabilize the collagen triple helix structure. Without those enzymes functioning correctly, the collagen your fibroblasts do produce is structurally weak and degrades rapidly. When your mitochondria are compromised through chronic inflammation, sedentary behavior, high oxidative stress, or poor diet, fibroblasts produce less collagen, and what they do produce is of inferior quality. You are essentially building a house with wet concrete in the rain. The lymphatic component, why your arms are drinking through their legs. The lymphatic system is a network of vessels that runs through your connective tissue, clearing metabolic waste, excess interstitial fluid, and inflammatory proteins. The upper arm has a dense concentration of lymphatic vessels, and when those vessels become sluggish or obstructed, fluid accumulates in the interstitial space of the tissue. Think about this visually. When you squeeze waterlogged bread, it doesn't spring back. It just deforms. That is exactly what happens to fascia that is edematous and inflamed. It loses mechanical resilience. It sags, it pools. You are essentially drinking through your legs. The fluid is going in but has nowhere to go. The tissue becomes boggy, dense, and loose all at once. This is why the typical do more tricep dips advice is so frustratingly ineffective. You can strengthen the triceps muscle all you like, but if the connective tissue scaffold draped over that muscle is degraded, glycated, and waterlogged, you will build a stronger muscle underneath a collapsed tent. The tent does not tighten. The muscle simply pushes the tent up slightly. This is not a fat problem. It is a connective tissue failure problem, and that changes everything about how we approach it. Let me address the single biggest myth in this space, the one that is genuinely causing harm because it is distracting people from real solutions. The myth: saggy arms are caused by loose skin from weight loss or aging and can only be fixed with surgery. This is clinically false. And here is why. When dermatologists and surgeons describe loose skin, they are typically discussing severe, rapid weight loss cases. Patients who have lost 100 pounds or more over a short period, and where the dermis has been genuinely, irreversibly overstretched. That is a real phenomenon. But it describes a small minority of people struggling with upper arm appearance. For the overwhelming majority, the people who have not had dramatic weight loss, who are simply seeing normal age-related changes in the arm tissue, the tissue has not been stretched beyond repair. The fibroblasts in the dermis are still alive and capable of responding to the right biochemical signals. The lymphatic channels are sluggish, not destroyed. The collagen scaffold is degraded and cross-linked, but that process is not a one-way door. Research into dermal remodeling, including studies using topical agents, dietary interventions, and specific movement protocols, clearly demonstrates that fibroblast activity can be upregulated. Collagen synthesis can be stimulated. Lymphatic clearance can be restored. The structural integrity of the superficial fascia can be meaningfully improved in a period of weeks to months with consistent, targeted intervention. The surgery narrative is extremely convenient for the cosmetic surgery industry. I am not disparaging surgeons. There are cases where surgery is the appropriate tool, but surgery does not address the underlying biochemistry. Patients who have arm lift procedures and do not change the glycation, the inflammation, the lymphatic stagnation, and the nutritional deficiencies that cause the problem frequently find that the tissue quality around the scar begins deteriorating within a few years of the procedure because the environment that created the problem is still intact. This is not a theory. It is a documented physiological reality. Fix the soil before you plant the seed. Now I'm going to give you something practical, a specific step-by-step protocol built around the 4 targets we need to address simultaneously. Stimulating fibroblast collagen synthesis, reducing glycation and MMP overactivation, restoring lymphatic flow in the upper arm, providing the specific cofactors collagen production requires. This protocol has 3 components: a morning drink, a topical application, and a movement micro-protocol. All of it uses things that cost almost nothing. Timing: 30 minutes before breakfast on an empty stomach. Taking this before eating is critical. In a fasted state, your growth hormone levels are higher, and the amino acids you are consuming will be preferentially directed toward tissue synthesis rather than energy metabolism. Ingredients: 10 grams of type 1,3 hydrolyzed collagen peptides. Measure this precisely with a kitchen scale. Do not estimate. Most scoops in commercial products are inaccurate. You need 10 grams of actual hydrolyzed collagen protein. Hydrolyzed means the collagen has been broken into short-chain peptides that survive digestion and reach the bloodstream as intact. Signaling molecules that stimulate fibroblasts. 250 milliliters of warm, not boiling water. Boiling water above 70 degrees begins denaturing some of the peptide structures. Juice of half a fresh lemon, approximately 15-20 milliliters. This provides approximately 25 to 30 milligrams of vitamin C, which, as I described earlier, is a non-negotiable cofactor for collagen cross-linking. The acidic environment also improves peptide absorption. 1 4 teaspoon of ground ginger, approximately 1.2 grams. Ginger contains gingerols and shogols, which have been shown in published research to inhibit matrix metalloproteinase activity, directly suppressing the enzyme that is destroying your existing collagen. 1 pinch of black pepper, approximately zero point 0.1 grams, contains piperine, which increases bioavailability of the other compounds by up to 20%. Stir. Drink slowly over 5 minutes. Do not rush this. Allow the peptides to absorb before introducing other food. On the days you do not have collagen peptides, substitute with 200 milliliters of bone broth, specifically slow-simmered bone broth, not stock. Bone broth contains hydroxyproline and glycine in natural ratios. Timing: every evening after shower while skin is still slightly damp. You cannot absorb collagen through your skin. Any product claiming to deliver collagen transcutaneously is misleading you. However, you absolutely can create a topical environment that reduces MMP activity and stimulates local fibroblast response. The application: 200 milliliters of extra virgin rosehip seed oil, measured in a small syringe or dropper. Rosehip oil contains trans-retinoic acid precursors, natural vitamin A compounds, and linoleic acid, both of which have documented evidence for stimulating dermal fibroblasts and reducing collagen cross-linking. Mix with 3 drops of pure vitamin C serum, L-ascorbic acid, minimum 10% concentration. Available at any pharmacy. L-ascorbic acid penetrates the stratum corneum and reaches fibroblasts in the dermis. At 10% concentration, it has been shown to increase collagen type I synthesis by up to 8-fold in human fibroblast cell studies. Apply to the back of both upper arms using circular friction massage. Not gentle stroking, but deliberate, slightly firm circular pressure. 40 circles on each arm. This friction serves 2 purposes. It mechanically stimulates fibroblast activity, mechanotransduction, the conversion of physical force into cellular chemical signals, and it actively pushes lymphatic fluid toward the axillary lymph nodes in your armpit where it can be cleared. Pressure: enough to see slight skin blanching and return of color. Not painful, about 60% of firm pressure. Timing: morning, immediately after your collagen drink. Duration: 8 minutes. This is not a workout. This is a deliberate physiological stimulus sequence. Step 1. Diaphragmatic breathing, 2 minutes. Stand or sit tall. Inhale deeply through your nose for 4 seconds, expanding the belly outward. Hold for 2 seconds. Exhale slowly through pursed lips for 6 seconds. Repeat for 2 minutes. Why? Your thoracic duct, the main lymphatic drain of your body, is powered by negative pressure changes in your chest cavity during breathing. Deep diaphragmatic breathing is the most powerful, non-invasive way to accelerate lymphatic flow throughout the entire upper body, including the arms. Step 2. Arm swings with resistance. 3 minutes. Use a light resistance band, or even a stretched-out pair of tights. Hold it taut between both hands at shoulder width. Perform slow, controlled arm swings, forward up, back down, completing 1 full revolution in 4 seconds. The resistance band creates intermittent compression and release in the arm tissue, mechanically pumping lymphatic fluid and increasing local blood flow to the dermis. 30 repetitions. Rest 30 seconds. 30 more repetitions. Step 3. Arm overhead gravity drain. Mine 3 minutes. Lie on your back. Raise both arms directly overhead so they are pointing toward the ceiling. Slowly open and close your hands, 10 seconds open, squeeze closed for 2 seconds, for 3 minutes. This uses gravity to drain interstitial fluid from the lower arm back toward the axillary lymph nodes. It sounds almost embarrassingly simple, but this is a modified version of the lymphatic drainage techniques used in clinical settings for patients with lymphedema, fluid accumulation in limb tissue. You are applying the same physiological principle to chronically edematous arm tissue. I want to tell you about a patient I'll call Miriam. She came to see me at 47 years old. She had been a PE teacher for 20 years, genuinely active her entire adult life. She was not overweight, She exercised regularly. She ate by any reasonable standard, quite well. But for the past 4 years, the backs of her arms had progressively changed. She told me she had stopped wearing sleeveless tops. She had started wearing long sleeves in summer. She felt, in her own words, betrayed by her body after a lifetime of taking care of it. She had seen 2 doctors before me. One told her it was normal aging. The other told her to do more arm toning exercises. Neither ran a single lab test. Neither asked her about her dietary protein intake. Neither palpated the tissue of her arm to assess its consistency and lymphatic status. When I assessed Miriam, what I found was a profoundly typical picture. Her serum vitamin C was in the low normal range. Not deficient enough to flag in a standard blood panel, but far below the threshold required for optimal collagen synthesis. Her fasting insulin was elevated at 11.2, indicating low-grade insulin resistance, and the glycation process I described earlier was almost certainly accelerating. And when I pressed gently along the posterior aspect of her upper arm, the tissue had that characteristic doughy, slow recoiling quality consistent with lymphatic congestion and fascial fibrosis. I put Miriam on a version of exactly this protocol. I also addressed her insulin sensitivity through dietary changes, reducing refined carbohydrates to limit the glycation load, and added a targeted antioxidant supplement to address oxidative stress. At 8 weeks, she noticed the tissue felt firmer to the touch. At 12 weeks, she sent me a photograph wearing a sleeveless blouse at her daughter's wedding. She cried when she sent it. I kept that message. She told me, "Nobody ever explained to me what was actually happening. They just told me to try harder." That is what keeps me making these videos. That is exactly what this channel is for. I want to ask you something, and I genuinely want you to answer in the comments below because it changes how I create content. How old are you? Drop your age in the comments right now. Just a number is fine. Because here's the truth. The protocol I just described has to be calibrated differently depending on your decade of life. The biochemistry of tissue remodeling at 35 looks different from what it looks like at 55. The speed of response is different. The nutritional cofactor priorities are different. The role of hormonal status, particularly estrogen, which directly regulates fibroblast activity, matters enormously at different life stages. If I know what decade of life most of my audience is in, I can make a dedicated video for your specific physiology. So please drop your age below. Tell me your number. It literally shapes the next video I make. And if you have been following this protocol already, or if you are going to start today, tell me that too. I read every comment. That is not marketing. That is just the truth. Let me bring everything together because I want you to leave this video with absolute clarity on what to do. Here are the 7 non-negotiable keys from everything I just taught you. Key 1. Saggy upper arm tissue. In the overwhelming majority of cases is a connective tissue failure, specifically a collagen matrix collapse combined with lymphatic congestion. Not a fat problem. Treating it as a fat problem guarantees failure. Key 2. The root mechanisms are glycation of existing collagen fibers, overactivation of matrix metalloproteinases, fibroblast energy deficiency, and lymphatic stagnation in the superficial fascia. These are the 4 targets, all 4 simultaneously. Key 3. Every morning, 30 minutes before breakfast, drink your 10 grams of hydrolyzed collagen peptides with 250 milliliters warm water, juice of half a lemon, a quarter teaspoon of ginger, and a pinch of black pepper. Empty stomach every single day. Key 4. Every evening after your shower, apply 2 milliliters of rose hip oil, mixed with 3 drops of 10% vitamin C serum, to the backs of your upper arms. 40 firm circular strokes per arm. This is not optional for the topical component. The mechanical stimulation is as important as the chemistry. Key 5. Every morning, do the 8-minute lymphatic micro-protocol. Diaphragmatic breathing, banded arm swings, and the overhead gravity drain. This is the piece most people will skip because it seems too simple. Do not skip it. The lymphatic system has no pump. Movement is its pump. Key 6. Reduce your dietary glycation load. This means specifically reducing refined sugars and high glycemic carbohydrates, not because of calories, but because glucose is literally degrading your collagen via the age formation pathway. This is non-negotiable for the underlying biochemistry to shift. Key 7. Give it time. The collagen remodeling cycle operates on a timeline of weeks to months, not days. You will likely notice tissue quality changes before you notice visible changes. The tissue will feel firmer before it looks firmer. Trust the process. I want to leave you with this. The standard system was built to treat you after you become sick. It was not built to protect the structural integrity of your connective tissue at 45. It was not built to explain glycation to you before it causes visible damage. It was not built to teach you that 8 minutes of deliberate breathing and movement every morning can restore lymphatic flow to tissue that has been congested for years. That is not a failure of individual doctors. That is a failure of the model. The system profits from treatment. I profit from you not needing me anymore. That is the only business model I have ever believed in. Subscribe, share this with someone you love, and I will see you in the next video.